I am Dr. Apurva Satish Amarnath. I am a fertility consultant with the Kammanahalli Center in Bangalore. So today we will be talking about when couples should go in for IVF treatment per se. So before starting about when you should go in, I'll talk about what IVF itself is. So IVF is when we combine the egg and the sperm of the wife and the husband in the lab and create an embryo and then transfer the embryo back into the uterus. So this kind of treatment is reserved for certain kinds of situations where you have been having difficulty getting pregnant, where there is a tubal factor or a tubal block, cases of endometriosis, where the egg reserve, that is the ovarian reserve, has completely reduced. The wife's age is more, that is more than 35 years of age. There is severe male factor, low semen counts, long-standing unexplained infertility where all the reports are normal but you have not been able to conceive at all, and in terms where you need to do a genetic screening of the embryos for any reason, like there is inherited conditions in the couple. So we do something called a pre-implantation genetic screening or a pre-implantation genetic diagnosis for which IVF needs to be done. So IVF by itself, what we do is we try and grow as many eggs as possible in a particular cycle for the women. So what is done is, starting on the second or third day of the cycle, we start injections lasting for about 10 to 12 days to grow the eggs. And once the eggs have reached an appropriate size, we give an injection to cause the final maturation, and then we do something called an egg collection. Once we do the egg collection, we do look at the egg quality under the microscope, assess and grade the eggs, and then inject a single sperm into it and grow these embryos for about 5 days, that is up to the blastocyst stage. And depending on the grading of the embryos, we transfer them back into the uterus for a pregnancy to happen. And about 12 days to 14 days after the embryos are transferred, we do a beta HCG or the pregnancy test to confirm whether a pregnancy has happened or not. So the overall success rates of IVF treatment is around 65%. It also depends on multiple factors, so success rates are individualized according to each situation. The younger you are, the better your success rates are, and the older you are, the harder it gets to get pregnant even with treatment. So some of the things that you have to look for before you choose to do an IVF treatment once it is decided for you is, one is where you do get it done, because that is an important factor when you decide to do treatment. You have to be comfortable with the clinician who is treating you. Also, the embryology laboratory has to be well equipped and with well-trained professionals. They're giving you good results, and also a robust counseling team so that it helps in you dealing with the entire process of IVF. All this is present at Nova, and we do try to make the entire treatment journey easy for you, and it is also personalized according to each couple's requirements, and things are smooth sailing after that.